Good morning, welcome to my channel Science and Society. Today we are going to talk about liver function tests. Before explaining liver function test, I want to tell about little bit about anatomy and functions of the liver. So liver is largest gland in our body. It weighs approximately 1.5 kg and liver consists of four lobes, the larger right lobe and left lobe, and then we have small quadrate lobe and quadrate lobes. Liver lobes can be further divided into 8 segments which are made up of thousands of lobules, smaller lobes. Each of these lobes has a duct flowing towards a common hepatic duct which drains bile from the liver. So we have a right lobe and left lobe. This side is right side of that person. Suppose it is the person, so this will be the right side and this will be the left side. Coming to the functions of the liver, as liver has many functions, some of the functions of the liver are metabolic functions. So it performs different metabolic functions. There are different metabolic pathways and their enzymes are operating in the liver. Liver also has excretory functions. Whatever drug, toxin which goes in our body, any pollutant which goes in our body, our liver is capable of detoxifying it. It is capable of adding different groups to that compound and ultimately making it water soluble. Once it is water soluble, it can be very easily excreted through our urine, because urine also contains water. So this adding of these groups, it makes it water soluble. Liver also has protective functions. There are Kupffer cells which are present in the liver, which help in engulfing or eating different bacteria or different antigens or foreign things. Liver also have storage functions. It helps in the storage of glycogen, so it acts as a storage or reservoir of our energy, glucose molecules in the form of glycogen. Iron, vitamin B12, these are some of the things which are stored in liver. Liver also have some hematological functions. In infants, blood is formed, hematogenesis takes place in the liver. So, keeping in view that this liver is major metabolic organ present in our body. So, if there is any damage that disturbs or that destroys our liver cells, it will affect our bodily functions. Some of the damages or some of the causes which can damage our liver are viral infection. Suppose hepatitis B, hepatitis C, those viruses, they can damage, they can destroy our liver cells. Cholestasis, while there is any blockage in the liver bile flow and all those things, so they can also cause problems in the liver. If there is excessive use of alcohol, that can also damage our liver, or some of the drugs, they can also inhibit or they can also destroy our liver. Liver also has some metabolic disorders are there, some of the enzymatic pathways which are inoperational, which are not functioning. So because of those, there is some accumulation of some compounds in the liver, so ultimately liver gets damaged. So if there is damage from any of these causes, so there will be the alteration in the function of the liver. So how can we diagnose that? For that we are having liver function tests, LFT. Liver function tests are functional tests. These are diagnostic tests which help us in assessing the function of the liver. Before performing liver function test, we have to keep some considerations. Suppose one of the consideration is liver is a large organ, so it can perform functions despite the damage. So our functions, our liver test will come normal, but there will be some damage because it is a large organ. It can cater to the needs of the body, basic needs of the body. So we have to select appropriate test for assessing liver function test. Next, we can classify these liver function tests based on different functions of the liver. Some of the tests are based on the excretory functions of liver. Some tests are based on the enzymes, certain enzymes which originate from the liver. Some of the enzymes, their origin is from the liver. So we have different tests. If there is increase or decrease in the enzyme level, that tells us some diagnostic information about the function of the liver. Some metabolic capacity of the liver, those tests are also there. Synthetic functions of the liver. Liver also has synthetic functions like albumin is synthesized, blood clotting factors are synthesized by the liver. So if there is any abnormality in the synthesis of albumin, in the synthesis of blood clotting factors, it gets affected, it gets conveyed in terms of alteration in the functions. So that can also tell us about the states of the liver. And liver is major detoxification agent. It detoxifies different toxins, drugs and pollutants. So based on these parameters, we have different functions, different liver function tests. Let us discuss these two problems. We have healthy person. Obviously, if he is a healthy person, he will be having a healthy liver. So his liver will be optimal function. So his liver will be functioning very nicely, optimally. So he will be obviously having healthy body. He will be having hepatic function reserves. So whatever liver has the capacity to perform functions, so there will be reserves. That particular person can perform larger functions related to the liver. So that person is having hepatic functional reserve. Okay. So if in that person we ingest or we inject some extra material which is to be detoxified by the liver, so that extra compound will be also normally metabolized by the liver because it has hepatic function reserve. Every parenchymal cell, parenchymal tissue of the liver is functioning properly. So if there is any extra thing, that will be excreted, that will be detoxified very nicely. Now come to this next problem. Here we are having a person which is having liver problem. So obviously he will be having minimal function test of the liver, minimal functions due to liver. So obviously that will be having some ailment or some disease, and the person will be having reduced functional reserve. Liver reduced functional reserve. So if we ingest or inject any extra material, what will happen? That material will get accumulated in the blood of that particular person. Okay, because there is already a reduction in the functional reserve of that particular person. So based on these things, we are basing some of our tests. We are having different tests. So liver function tests, they are markers of liver function. We have markers based on excretory function of the liver. Bilirubin is a bile pigment. It is produced and excreted and is an end product of hemoglobin degradation. Hemoglobin is present in our RBCs, red blood cells. It is the compound or the pigment which is responsible for blood oxygen transport. So once that RBC is destroyed in our body, its excretory product will be hemoglobin. So there is a normal range of hemoglobin, 0.2 to 1 milligram per deciliter. Among this 1 milligram hemoglobin conjugated bilirubin, 1 milligram bilirubin, conjugated bilirubin will be 0.2 to 0.4 milligram per day. This is mono and digluconide. These are the compounds which are gluconides which are added by the liver to make this bilirubin water soluble so that it will be excreted through our urine. Okay, and majority of it 0.2 to 0.6 milligram per dl, that is unconjugated bilirubin. If bilirubin is conjugated, it is added with mono or digluconides that makes bilirubin water soluble and bilirubin can be excreted through the urine. If it is unconjugated, that makes this bilirubin water insoluble. Suppose this is blood and we are having different types of red blood cells in the blood, and these red blood cells, they will be having heme or hemoglobin. Once it is metabolized, we will be having bilirubin. Then bilirubin will be conjugated by liver into bilirubin digluconate or bilirubin monogluconate. Okay. So till now we get one important information. Bilirubin is excreting product of heme that is produced from red blood cells. After red blood cells are destroyed by any mean or any mechanism, we have bilirubin production. Then that bilirubin is made water soluble by our liver by adding mono or digluconide, that is making this bilirubin conjugated bilirubin. Once bilirubin is conjugated bilirubin, it is water soluble, it can be excreted through our urine, and some of the bilirubin is unconjugated, so it is water insoluble. We have one simple test. This test was used from prehistorical time, that is called icterus index. In icterus index, what we are doing? We are preparing plasma. We are preparing the serum of that particular patient, and then by means of eyeballing, we are putting two test tubes of a normal person and another person which is having this, which is mostly having any jaundice or some liver related problem. Then we are comparing, eyeballing, and seeing how that serum looks, whether it is more yellow or less yellow. If there is intensity of yellow color over there, we can presume that that person might be having some liver problem. So that is icterus index. It is very rough test. Then come to another test, which is Vannden-Berg reaction. This is very important reaction for assessing liver function test. In Vannden-Berg reaction, what we are doing, we are having two types of reagents. Equal volumes of sulfonic acid in dilute HCl and sodium nitrate. Once these two compounds are mixed, we get a diazotized sulfonic acid. Okay, so this reagent is giving us this particular compound, diazotized sulfonic acid. Then we are having this direct Vannden-Berg reaction. So direct Vannden-Berg reaction is, here we are adding Vannden-Berg reagent and we are having conjugated bilirubin. Conjugated bilirubin, as I told you earlier, it is water soluble. So because this conjugated bilirubin is water soluble, it will immediately react with Vannden-Berg reagent, and in 30 minutes we will get purple color. This is called direct Vannden-Berg reaction. So this direct Vannden-Berg reaction, it tells that conjugated bilirubin is present. Then we are having indirect Vannden-Berg reaction. In indirect Vannden-Berg reaction, we'll be having Vannden-Berg reagent, as I have already discussed, sulfonic acid and sodium nitrate. They are making diazotide sulfonylic acid. This once combined with unconjugated bilirubin. Unconjugated bilirubin is water insoluble. Then, if you will directly combine these two, we will not get any purple color unless we are adding methanol. Once methanol is added, this makes this unconjugated bilirubin somewhat soluble, and then this Vannden-Berg reagent can react with unconjugated bilirubin that is made soluble by methanol. Then in 30 minutes we are getting purple color. This is called indirect Vannden-Berg reaction because we need to add methanol to make it water soluble unconjugated bilirubin, and then we are getting purple color. So we are getting indirectly purple color. We have to add methanol. Then we have another Vannden-Berg reaction that is called biphasic Vannden-Berg reaction. In biphasic Vannden-Berg reaction, suppose we are having a sample which is having both conjugated and unconjugated bilirubin in high quantity. So what will happen? We will add Vannden-Berg reagent and then we will add sample. Sample is containing conjugated and unconjugated bilirubin. Then in 30 minutes we will be getting purple color. Why we are getting purple color? Because conjugated bilirubin is present here. Then if we will add methanol, what will happen? This purple color will intensify. It will increase in intensity. So that is called biphasic Vannden-Berg reaction. So this biphasic Vannden-Berg reaction tells us that sample contains both conjugated and unconjugated bilirubin. So this is biphasic Vannden-Berg reaction. So I will repeat it. So in biphasic Vannden-Berg reaction, what we are having? We are having a sample that is having both conjugated and unconjugated bilirubin present. So once Vannden-Berg reagent is provided, we get a purple color in 30 minutes. This purple color is because conjugated bilirubin directly reacts with the Vannden-Berg reagent and we are getting purple color. Then if we add methanol, we will get intensification of this purple color. This is because methanol makes this unconjugated part of the bilirubin soluble and then it reacts with the Vannden-Berg reaction. So we get intensification of the color. Okay. So how this Vannden-Berg reaction will help us in diagnosing different types of jaundice. Okay. Jaundice is a hematological a disease where there is increase in the bilirubin content, whether conjugated or unconjugated bilirubin is elevated in the blood. Okay, so it gives this yellow color of the skin or yellow color of the sclera of the eyes. So we have one type of jaundice called as hemolytic jaundice. As the word suggests, hemolytic jaundice is a jaundice where there is hemolysis, breakdown of red blood cells. Red blood cells are breaking down. Those red blood cells may lyse because patient is taking some drug. That drug is reacting with his RBCs and it is causing hemolysis. Or maybe he has some genetic predisposal. He has some genetic disease, because of this his RBCs are lysing. His RBCs are getting lysed. So there is hemolysis, so lot of heme will be released. Lot of the hemoglobin will be released from the RBCs. So that will be converted into bilirubin. But in hemolytic jaundice, liver does not have ability. It is overloaded. because of large concentration of unconjugated bilirubin that is coming from hemolysis of RBCs. So this hemolytic jaundice should give us indirect positive Vannden-Berg reaction, because in hemolytic jaundice liver is not capable of conjugating the bilirubin. So lot of unconjugated bilirubin is present because lot of hemolysis is happening and liver is getting overloaded and liver is not capable of conjugating this bilirubin. So hemolytic jaundice will be diagnosed by indirect Vannden-Berg reaction. If we are having indirect Vannden-Berg reaction, so that means hemolytic jaundice. Obstructive jaundice is another type of jaundice where there is obstruction in this common biliary duct. Obstruction can be due to tumor, it can be due to tumor or some other thing, maybe some parasite is over there or some other things are there. Because of that, obstruction is happening. It is also called post-hepatic jaundice. After liver there is obstruction. So if there is obstruction, so liver has already done its work, it has already conjugated the bilirubin, it has made it conjugated bilirubin. So this conjugated bilirubin is not passing into the intestines, it is not going into the intestines for performing its functions, so it gets reabsorbed in our blood. So in this case, conjugated bilirubin will be increased. Because of obstruction, the bilirubin which is already conjugated by the liver, it is incapable of moving into intestines, so it gets reabsorbed into blood circulation. So we have increase in the conjugated bilirubin concentration, so it gives direct positive results. Then we have another kind of jaundice called as hepatic jaundice. In hepatic jaundice, whole liver is involved, so both conjugated and unconjugated bilirubin concentration will increase, so it should give us biphasic Vannden-Berg reaction. Okay, so this is how this simple test, Vannden-Berg reaction, helps us in assessing the liver function. We have, okay, so that is for now. Thank you. I will continue in other lectures liver function tests. Thank you so much.